August 7th, 1942. The USS Macaulay cuts through the dark waters of the Solomon Sea, carrying men who still don't know what awaits them on that volcanic island called Guadalcanal. Among them, Dr. Thomas Keller grips his medical bag with the same intensity a soldier holds his rifle. He is 32 years old, graduated from Johns Hopkins, and has spent the last 3 years in military hospitals far from any front line. In his mind, war is an abstraction made of statistics and official reports. He's about to discover how wrong he is. The landing boats hit the black sand beach at dawn. Keller steps into knee-deep water, feeling the weight of his equipment drag him down. The jungle before him is a green wall, dense and threatening. The air is thick, suffocating, saturated with humidity that makes every breath an effort. Within minutes, his uniform is soaked in sweat. This is not the sanitized war of training manuals. This is something primordial, visceral. The field hospital is a collection of tents erected in a clearing barely conquered from the jungle. There are no beds, only canvas stretchers on the mud. Medical supplies are scarce, bandages, morphine, plasma. Everything is rationed with the desperation of those who know more will not arrive soon. Keller looks around and sees exhausted faces, doctors and nurses who have already learned what he is about to discover. Here, medicine is not a science of precision, but an art of impossible choices. The first wounded arrive before he can even organize his instruments. A Marine with his left leg shredded by shrapnel, another with his abdomen opened by machine gun fire, a third burned beyond recognition. They scream, they cry, they beg. Keller freezes for a moment, paralyzed by the violence of it all. In the hospital back home, patients arrived clean, anesthetized, prepared. Here, they arrive covered in mud, blood, and the stench of death. His hands tremble as he performs his first triage. Who lives? Who dies? Who gets morphine? Who waits? These are decisions that should be made by God, not by a doctor, who 3 days ago was reading journals in a comfortable office. But there is no time for philosophy. A sergeant grabs his arm and shouts something about Japanese positions nearby, about the possibility of an attack at any moment. Night falls, and with it comes a new hell. The Japanese bombers arrive precisely at sunset, a macabre routine that will repeat itself every night. The explosions shake the ground. The wounded scream louder. Keller operates under the light of oil lamps, his hands covered in blood that is not his own. He amputates a leg. He closes a chest wound with sutures that would be considered barbaric in any civilian hospital. He holds the hand of a boy who dies calling for his mother. When dawn finally breaks, Keller walks out of the surgical tent and vomits behind a tree. He has operated for 18 consecutive hours. He has lost count of how many men passed through his hands, how many he saved, how many he watched die. His white coat, which he boarded wearing with pride, is now a canvas of brown and red stains. He looks at the jungle ahead, dense and indifferent to human suffering. Somewhere in that green hell, thousands of Japanese soldiers wait. And between them and the American lines, there is only mud, disease, and death. Keller finally understands. Guadalcanal is not just a battle. It's a test of how much humanity can endure before breaking. 3 days on Guadalcanal, and Thomas Keller has already aged years. Sleep is a luxury he can no longer afford. The wounded keep arriving in waves, some carried by their comrades, others dragging themselves through the mud, leaving trails of blood that attract swarms of flies. The operating tent has become a slaughterhouse, where Keller plays God with increasingly numb hands. The triage system is simple and cruel. Black tags for those who will die regardless of intervention. Red for those who might survive with immediate surgery. Yellow for those who can wait. Green for the walking wounded. But theory crumbles in practice when you look into the eyes of a 19-year-old boy marked with black and have to move on to the next stretcher. Sergeant Miller brings him the morphine inventory. 12 vials remaining. Keller does the math. At least 40 wounded need pain relief. 12 vials, 40 men. The equation has no humane solution. Some will have to suffer in full consciousness while he operates. Some will have to die listening to their own screams. Then comes the moment that will haunt him forever. 2 stretchers arrive simultaneously. On the left, Private Davidson, 23, from Iowa, both legs destroyed by a landmine. On the right, A Japanese soldier, perhaps 25, tan with a similar injury. Shrapnel has torn through his abdomen and right leg. Both are bleeding rapidly. Both will die without immediate intervention. Keller has time and resources to save only one. The other doctors don't even look at the Japanese soldier. The choice seems obvious to them. Davidson is one of ours. The enemy soldier is precisely that. Enemy. But Keller sees something else. Two young men equally far from home, equally terrified, equally human. His hands move before his mind decides. He begins working on Davidson, applying tourniquets, preparing the amputation, but his eyes keep drifting to the Japanese soldier, who watches him with an expression Keller cannot decipher. Not hatred, not even fear, just resignation. Davidson survives. The amputation is rough but effective. He'll return home, maimed but alive. The Japanese soldier dies 30 minutes later, alone on his stretcher, while Keller operates on another American. No one notices except Keller, who feels the precise moment when that life extinguishes. That night, unable to sleep, Keller sits outside his tent and stares at the darkness of the jungle. He made the right choice according to military protocol. He saved an Allied soldier. He let an enemy die. This is what he was trained to do, but his hands still tremble. He thinks about the Hippocratic oath he took years ago in a ceremony full of idealism and solemn promises. First, do no harm. The oath didn't mention anything about choosing which lives deserve to be saved based on the uniform they wear. In the distance, artillery rumbles. More wounded are coming. More impossible choices await. Keller closes his eyes and tries to remember who he was before Guadalcanal. That man seems like a stranger now, someone naive who believed medicine existed above war, that healing was always an absolute good. Here, in this green hell, even salvation has become a weapon. The rain arrives in the second week, transforming Guadalcanal into an endless swamp. Water seeps through everything: tents, bandages, wounds. The mud becomes a living entity that devours boots, equipment, hope. But the rain is not the worst enemy. The real killers are invisible. Malaria strikes first. Captain Reynolds, a surgeon who has been operating alongside Keller, collapses during a procedure. High fever, violent chills, delirium. Within 24 hours, half the medical staff shows symptoms. Keller watches his colleagues transform into patients, their faces yellowed by fever, their bodies shaking uncontrollably. The quinine supplies are depleting faster than combat bandages. Then comes dysentery. The contaminated water, the inadequate latrines, the swarms of flies that land on food and wounds with equal enthusiasm, everything conspires to spread the disease. Men who survived Japanese bullets now spend their days and nights emptying themselves until there's nothing left but weakness and despair. Dehydration kills as efficiently as any rifle. Private Coleman arrives at the hospital not wounded, but skeletal. He's been on the front lines for 3 weeks, surviving on half rations and rainwater. His gums bleed from scurvy. His skin is covered in tropical ulcers that refuse to heal. He weighs perhaps 40 pounds less than when he landed. Keller examines him and realizes with horror that Coleman looks like photographs of concentration camp victims he's seen in medical journals. The food situation deteriorates daily. Supply ships can't reach the island regularly. Japanese naval forces control the waters at night. What little arrives is barely enough. The troops call it starvation rations, with dark humor, rice contaminated with weevils, canned meat that may or may not be spoiled. Keller watches soldiers pick insects from their food and eat them anyway, grateful for the protein. In the surgical tent, infection has become the norm rather than the exception. Every wound, no matter how well cleaned, becomes a breeding ground for bacteria in the tropical heat. Gangrene spreads with terrifying speed. Keller performs amputations not because of combat injuries, but because a small cut on someone's foot has become a life-threatening infection. The smell of rotting flesh permeates everything. Nurse Patterson, who has worked tirelessly since landing, breaks down one afternoon. Keller finds her behind the supply tent, sobbing uncontrollably. She's just watched her 4th patient die of malaria in 2 days. Men she couldn't save because there wasn't enough medicine, enough clean water, enough of anything. Keller tries to comfort her but finds no words. What can he say that it will get better? They both know that's a lie. The island is killing them as surely as enemy bullets, just more slowly, more cruelly. That night, Keller writes in his journal by candlelight, his hand shaking from exhaustion and the early tremors of fever he refuses to acknowledge. "We came here to fight the Japanese," he writes, "but our real enemies are mosquitoes, bacteria, and hunger. The jungle doesn't care which flag we fly. It consumes us all equally." He closes the journal as another wave of wounded arrives, these ones covered not just in blood, but in the mud and filth that guarantee their wounds will never heal cleanly. The war continues. The island takes its toll, and Keller feels his strength fading with each passing day. James Hartley is 20 years old and has a photograph of his girl back in Tennessee folded in his breast pocket. He shows it to everyone, a pretty blonde with a shy smile, waiting for him to return so they can marry in the small church where they first met. Keller has seen that photograph a dozen times. Hartley carries hope like others carry ammunition. The offensive begins at dawn. The Marines push toward a Japanese position on a ridge overlooking Henderson Field. Keller hears the gunfire intensify, the explosions that shake the earth, the screams that carry through the jungle. Then the stretchers start arriving. Hartley comes in the third wave. His abdomen has been torn open by shrapnel from a grenade. Intestines protrude through the wound, covered in dirt and blood. His face is pale, his breathing shallow and rapid, but his eyes are still clear, still aware. He recognizes Keller. "Doc," he whispers, "am I going to make it?" Keller doesn't answer. He's already assessing the damage with the cold precision he's developed. Massive internal bleeding, multiple perforations in the bowel. In a proper hospital with blood transfusions, with adequate surgical facilities, with time, maybe. Here, with depleted plasma supplies, with instruments sterilized in boiling water, with another dozen critical patients waiting. The mathematics are merciless. But Keller tries anyway. He operates for 2 hours. His hands move with desperate efficiency, clamping bleeders, resecting damaged intestine, irrigating the abdominal cavity with precious saline. Nurse Patterson assists, anticipating his needs, her face a mask of professional composure that barely conceals her anguish. They both know Hartley. Everyone knows Hartley. The bleeding won't stop. Each vessel Keller clamps, another ruptures. The boy's blood pressure drops despite the plasma they're pumping into him. His pulse becomes thready, irregular. Keller works faster, his sutures increasingly frantic, but he's fighting biology itself and losing. Hartley's hand suddenly grips Keller's wrist with surprising strength. "Doc," he gasps, "tell Sarah! Tell her!" He dies before finishing the sentence. His hand goes limp. The monitor flatlines. Keller stands frozen, needle and suture still in his hands, staring at the young face that will never age beyond 20. Patterson gently touches his shoulder. "Doctor, we have others waiting." Keller doesn't move. He's thinking about the photograph in Hartley's pocket, about a blonde girl in Tennessee who doesn't know yet that her future has just ended on a muddy island thousands of miles away. He's thinking about all the promises he's made, implicit promises that his skill, his training, his dedication would be enough to save lives. They weren't enough. They're never enough. He removes his gloves mechanically and walks to the next patient. Then the next. Then the next. His hands perform the procedures automatically, while his mind remains trapped in that moment when Hartley's grip loosened, when hope died along with the boy. That night, Keller sits alone outside his tent, holding Hartley's photograph. He should send it back with the boy's personal effects, but he can't bring himself to let go. Not yet. In the distance, artillery rumbles, tomorrow's casualties announcing themselves. For the first time since arriving on Guadalcanal, Thomas Keller allows himself to cry. Not for long. There isn't time, but long enough to feel something crack inside him, something he's afraid he'll never repair. The war doesn't pause for grief. By midnight, more wounded arrive, and Keller returns to the operating tent, his eyes dry but hollow, a man beginning to understand that saving lives and losing his soul might be the same thing. 37 days on Guadalcanal. Keller has stopped counting the dead. The faces blur together now, young men who arrived screaming and left silent, wrapped in canvas because there aren't enough body bags. His hands work automatically, performing amputations and sutures with mechanical precision, while his mind retreats somewhere distant and numb. The nightmares began 2 weeks ago. Every time Keller closes his eyes, he sees Hartley's face, then Davidson's stumps where legs used to be, then the Japanese soldier he let die, watching him with those resigned eyes. They all blend together in his dreams, accusing him not with words, but with their silent presence. He's lost weight. His uniform hangs loose on a frame that's burning itself for fuel. Food tastes like ash. Sleep is impossible without the whiskey he's begun stealing from the medical alcohol supplies, just enough to quiet the voices in his head, not enough to impair his hands during surgery. At least that's what he tells himself. Patterson notices. "Doctor, you need rest." "There's no time for rest," he replies, his voice flat and emotionless. But she's right. The exhaustion has begun affecting his judgment. Yesterday, he nearly amputated the wrong leg before Patterson stopped him. This morning, he couldn't remember a patient's name, despite having operated on him twice. The edges of reality are becoming soft and unreliable. Then comes the moment that breaks him. 2 Marines arrive simultaneously, both with severe chest wounds. Private Chen, 22, from San Francisco, a sucking chest wound, penetrating cardiac injury, maybe 10 minutes before irreversible shock. Corporal Williams, 19, from Georgia, similar injury, similar timeline, similar chances. But there's only one functioning thoracic surgery kit. The other was destroyed in last night's bombing. Keller can save one, not both. He stands paralyzed between the 2 stretchers, his mind fragmenting. Who decides? What algorithm determines which 19-year-old deserves life and which deserves death? Is it medical factors, whose injury is more salvageable? Is it random chance? Whoever arrived first? Is it some cosmic justice system he doesn't understand? Chen's mother probably makes dumplings in Chinatown. Williams' father probably farms red clay soil. Both families will receive telegrams. Both will feel the same grief. How does Keller play God when there's no righteous criteria? His hands begin to shake uncontrollably. Sweat pours down his face despite the relative coolness of the morning. Patterson says something, but her voice sounds like it's coming from underwater. The tent spins. Keller chooses Chen, not for any medical reason he can articulate later. Just an instinct, a guess, a coin flip dressed in surgical scrubs. He operates with trembling hands while Williams dies 6 feet away, choking on his own blood. Chen survives. Williams doesn't. When it's over, Keller walks out of the tent and keeps walking. Past the perimeter, past the guards who shout warnings, into the jungle where snipers hide and landmines wait. He doesn't care anymore. Let the island take him. Let the war have one more victim. They find him an hour later, sitting against a tree staring at nothing. Patterson helps him back to camp, and for 3 days Keller doesn't speak, doesn't eat, doesn't operate. He sits in his tent, catatonic, a doctor who has finally understood that every life he saves is paid for with one he couldn't. Dr. Elizabeth Morrison arrives on the supply ship that finally breaks through the Japanese blockade. She's 45, a veteran of field hospitals in North Africa, with grey streaks in her hair and eyes that have seen enough suffering to fill libraries. She takes one look at Keller and recognizes what she's seeing. "You're done," she tells him flatly. "When did you last sleep more than 2 hours?" Keller doesn't answer. He's forgotten how to track time in conventional ways. Morrison doesn't wait for permission. She physically removes him from the surgical rotation, assigning him to inventory duty, counting bandages, organizing supplies, tasks that require no life or death decisions. Keller protests weakly, but his body betrays him. The moment he's relieved of responsibility, he collapses into 16 hours of dreamless sleep. When he wakes, Morrison is sitting beside his cot with 2 cups of something that might be coffee. "I lost a patient in Tunisia," she says without preamble. "A little girl, maybe 8 years old, shrapnel wound. I had everything I needed to save her, equipment, blood, time, but my hands were shaking from exhaustion, and I nicked an artery I shouldn't have touched. She bled out in 4 minutes. Keller looks at her, seeing his own anguish reflected. "I wanted to die," Morrison continues. "Thought about walking into the desert and not coming back. You know what stopped me? What? The next patient, and the one after that, and the 100 after that. She sips her coffee. You can't save everyone, Keller. This job, especially here, especially now, it's about mathematics. We save more than we lose, or we save less than we lose. That's the only metric that matters. That's cold. That's survival. Her voice softens slightly. The moment you start believing you're God, that your decisions are anything more than educated guesses in impossible circumstances, that's when you're finished. We're mechanics, Keller. We fix what we can fix. The rest is beyond us. Over the following days, Morrison integrates him back into rotation gradually. First assisting, then handling minor cases, finally returning to surgery. But she's always there, watching, ready to pull him back if he falters. Keller assists on a leg amputation, routine by Guadalcanal standards. The patient is Corporal Jackson, 24D, gangrene spreading from the infected wound. The surgery goes smoothly. Jackson survives, wakes up, and despite losing his leg, thanks Keller with tears in his eyes. You gave me a chance to go home, Doc. My little boy won't remember me whole, but he'll remember me alive. Something shifts in Keller's chest, not healing. Not yet, but a small crack in the numbness, letting a thin ray of light through. That evening, he joins Morrison and the other doctors for dinner, watery soup and stale crackers that taste like feast because he's eating with people who understand. They share stories, not of failures, but of small victories. Private Rodriguez, who walked again. Sergeant Kim, who regained use of his hand. Nurse Chen, who talked a delirious patient through his fever nightmares. The losses still haunt Keller. Hartley's face still appears in his dreams. Williams' death still weighs on his conscience. But Morrison is right. There will be another patient tomorrow, and another. And if Keller destroys himself over the ones he can't save, he betrays the ones he can. He picks up his medical bag again, feeling its familiar weight. The war continues. The wounded keep coming. But Thomas Keller is no longer trying to be God. He's just a doctor, doing his imperfect best in an imperfect hell. And somehow, that's enough. November 12th, 1942. 3 months since Keller first stepped onto Guadalcanal's black sand. The island has changed. Henderson Field is secure. Supply lines are established. The Japanese are retreating. But the cost has been astronomical. Thousands dead. Thousands more broken in ways that can't be measured by body counts. Keller has changed too. His hair has begun graying at the temples. Deep lines crease his face. His hands remain steady during surgery, but they shake afterward, a tremor he's learned to hide. He's thinner, harder, a man forged in conditions that should destroy human beings, but sometimes create something else instead. The final offensive comes without warning. Japanese forces, desperate and surrounded, launch a massive counterattack at Point Cruz. The goal is simple: break through American lines or die trying. They choose both. The wounded arrive in numbers Keller hasn't seen since the first days. The hospital is overwhelmed within an hour. Every tent, every available space fills with bleeding, screaming men. Morrison organizes triage teams, but there aren't enough doctors, enough supplies, enough hands to stem the tide of destruction. A runner bursts in, frantic. We need a doctor at the front line. Aid station took a direct hit. Everyone's dead or wounded. Keller looks at Morrison. She shakes her head. We can't spare anyone. We're barely holding together here. But Keller is already grabbing his medical bag. He's thinking about the boy he saw die at an aid station 3 weeks ago, bleeding out because no doctor could reach him in time. He's thinking about all the men who died not from their wounds, but from the time it took to get them to help. I'll go, he says. Morrison grabs his arm. That's suicide. The whole area is under fire. Then I better move fast. The journey forward is a nightmare. Artillery shells explode close enough to throw dirt over him. Machine gun fire stitches patterns in the mud. Bodies lie scattered, some American, some Japanese, all equally dead. Keller runs in a crouch, his medical bag clutched to his chest like a shield that will protect nothing. The aid station is carnage. The medic, Private Torres, is dead with half his head missing. 6 wounded Marines lie in various states of injury, one with both legs gone, another with his chest opened by shrapnel, a third blinded and screaming. They're too badly hurt to move, too far from help to survive. Keller works with controlled fury, tourniquets, pressure bandages, morphine injections. His hands move with the precision earned through 3 months of hell. He stabilizes the worst cases first, preparing them for transport back to the main hospital. Then he hears it, the whistle of incoming artillery. The shell lands 30 feet away. The concussion throws Keller against a tree. Something hot tears through his side, shrapnel, spinning metal that punches through flesh and muscle. He falls, gasping, his hand instinctively reaching for the wound. It's bad. Liver or kidney, maybe both. The kind of injury he's treated 100 times, the kind that needs immediate surgery, or the patient dies from internal bleeding. He has perhaps 20 minutes before shock takes him. But the wounded Marines are still here, still dying. Keller forces himself upright. Blood soaks through his uniform, warm and sticky. His vision blurs at the edges, but his hands remember what to do. He finishes stabilizing the last patient, calls for stretcher bearers on the radio, gives them coordinates.